Toppers are always from Dr. Bhatia Medical Institute, to which our sir, Dr. Bhatia, always says, others may call it a miracle, but for us it's a routine activity. So dear friends, after a long wait, the NEET result is finally out. And as someone wisely has said, history repeats itself. So once again, Dr. Bhatia Medical Institute proudly announces its toppers. Today we have here with us Dr. Abhishek Suman. I hope you must recognize him now. Dr. Abhishek has again made it. He's got rank 1 in Delhi PG and his NEET rank is 4. So today we have with us Dr. Abhishek Suman. Congratulations, Dr. Abhishek. Dr. Abhishek has stood rank 4 in NEET 2012. He also has a very good rank in DPG. His rank is 1. If we remember, Dr. Abhishek had stood rank 18 in November 2012 and rank 68 in PGI. Applauds for Dr. Abhishek. So now how is it? You're feeling all the more great?
Yeah, definitely God has given me a second chance. I'm just grateful.
Dr. Abhishek had picked up Opthal from AIIMS.
Yes, I am continuing with my MD Ophthalmology in AIIMS currently.
Okay. So now since Abhishek, you've got a very good rank, do you plan to switch over or what is it?
I'm thinking of switching over to a radiology course at Azad Medical College, but currently it's a dicey.
Okay. Abhishek, if we start all over again, although you have stood a topper in AIIMS and PGI, now students would like to know what kind of preparation you had for NEET. How is it that after scoring good in AIIMS and PGI, it is that you have been able to achieve a good position in NEET? What kind of preparation was yours?
Actually speaking, we didn't get much of a time to alter any kind of, make any kind of special changes in our preparation. That goes for me, for everybody else out there. So what I think in the last 10 days after the AIIMS exam, some extra add-ons which I made was that I could collect all the DNB questions from well-recognized sources, and that was only extra effort. For the last 3 years, whatever DNB questions from books were there available in the market, I collected them and went through them. And that in the end, in the NEET, I think that paid well enough for me for getting those extra 20 or 30 questions, which I think I would not have been able to do with the preparation which I already had. But apart from that, like the 240 questions in the NEET exam, the 200 questions, for that I think my theory preparation which went into AIIMS and PGI exams, that paid off just as well as they paid off for my AIIMS and PGI exams. So currently what I analyze is that the preparation was not very different for NEET exams. There were small add-ons, but the theory preparation, the basic things like the guidebooks which give the last year AIIMS and All India questions, what the whole country does, I think I also did the same thing, and they are still a good thing to stick with. That's what I feel.
Okay, Abhishek, you have been a part of our classroom program at Dr. Bhatia Medical Institute. How do you think being attending to the classes over here has helped you create a niche for yourself?
For this, first of all, I would like to dissect the NEET questions. After giving the exam, I placed all the 240 questions into 3 categories. The first category I feel is there is a set of 100 to 110 questions for which your basic medical college life knowledge, that's good enough to attend all those questions. If you have been even moderately interested in your classes for the last 4 years, then I think everybody stands a very good chance of attempting those questions. So apart from that, the next set of questions comes 80 to 90 questions for which you need the real effort, where my coaching institute Dr. Bhatia's comes into play. The test and discussion series which I joined at Dr. Bhatia's, they have been very helpful for me to maximize my attempts in those 80-90 questions. The test and discussion series gives you a 5 or 6 hour package for each subject, and that the productivity out of that 5 and 6 hours is a huge amount. So I feel like out of those 80 questions I could get to 70, that the whole credit goes to the test and discussion course at Dr. Bhatia's.
You mean to say that whatever content was being taught to you at the institute, it has helped you get a rank in AIIMS, PGI and NEET?
Yeah, definitely.
Can you please be a little more, inform us or inform the student? Can you please be more specific in what exactly you want to convey?
Okay. The faculties, what they teach us in the test and discussion program here, The teaching is in a very concise and very highlighted way. They cover all the things which are important things of the specific subject in pretty detail, and they also give us highlighters which came up later in my exam as the one-liners, which have become a very important feature of the new NEET exam. So I think making notes of those discussions and revising them in the last 1 week, that comes in very handy in the end. So that is the main important thing for test and discussion course.
Okay, fine. So Abhishek, finally, a message that you would like to convey to your juniors and the ones who will now be writing NEET, because NEET still is very uncertain. There are not many guidelines. Nobody knows exactly what is to be expected. And you are I think you are the one from where NEET starts.
We are one of the lucky beneficiaries of this NEET exam. I am very fortunate. One of the important things which I have seen amongst my friends and my juniors after this year's NEET has been that there is a lot of panic and a lot of chaos in the minds of the people about, they are thinking about some very radical shifts in their preparation. But from my experience which I draw, that is the preparation was not very much different because almost all throughout the last year we kept on with the preparation which we make for the previous all-India exams. So and that has paid off for me. So I think the theory-based preparation of focusing on the guidebooks for subject-wise preparation of the pre and para-clinical exams, along with that your test and discussion notes, keeping a certain notes for the last 1 month revision. And what you can add on is just the extra effort to collect the questions for the DNB exams, the last year's DNB exams, and start making a note of the one-liners in all the subjects you are studying. That is one extra effort which I can prescribe. That for all the subjects you keep a separate note along with you all the time and write this small one-liners. So in the end of the 1 year or 6 months you have a certain set of one-liner questions, and the exam is bound to be having lots of questions from there, great questions. So that is one advice I think I would like to convey.
In short, I would like to repeat what Dr. Abhishek has said. He has said 3 very, very important things. First thing is that in your years of MBBS, please stick to your theory, right? You need to have a strong foundation, so that in the year when you are preparing for PG entrance exam, you are able to revise it quickly. Second thing that what he said was, by joining Dr. Bhatia Medical Institute, the classroom program, the kind of content the faculty gave was very much what was required to write the NEET, all the entrance exams. Along with this, while teaching, the faculties also gave highlighters, which again helped him attempt the NEET entrance exam. The third thing that he has said is that your preparation should be strong. When it is strong, no matter what kind of changes are there at the entrance level, you will be able to attempt all the exams, and like him, all of you all can expect a good result.
One thing more I would like to add on is that all the students should give all the exams. Whatever be the state of your preparation, even if you are early on in your preparation, you should start giving exams, because the theory needed for all the exams is same if you look around. So don't escape from any kind of exams, AIIMS, PGI, any exams. Please write all the exams.
As well as NEET in case it is continuing. Thanks a lot.